been 565 deaths due to this global pandemic. This is an increase of 41 on yesterday's update. However, 33 of those deaths occurred prior to yesterday, and 8 of those deaths occurred in the last 24 hours. Of course, our thoughts, our prayers, our best wishes and our sincere condolences are with each of those families. I can provide some breakdown as to that group. 3 males and 4 females in their 70s. $2,248,814 test results have been received since the beginning of the pandemic. That's an increase of 14,435 since. There are 4,338 cases with an unknown source, with 112 that have been added via that coronavirus detective work. They've been closed out effectively and have been added since yesterday's report. There are 378 healthcare workers who are active cases, so those numbers continue to fall. And again, we'll take this opportunity to thank and to congratulate every single member of our health workforce who are working so hard to provide care and attention, love and support to every patient, every resident, every client that needs that care and support. And we send our best wishes to those who have contracted this virus and wish them well. Again, it's just another reminder, following the rules, doing the right thing, all of us playing our part. You can do it for lots of different reasons. 1, to avoid a fine. 2, to get out of these restrictions quicker. But thirdly, and in some respects most importantly, to say thank you to those health heroes. The better we all do, the more of us who play our part, the less patients there are in hospitals and the less risk there is to our health heroes in the work that they do. There are some 2,620 active cases across the state. That number continues to fall, which is pleasing. The metro regional split, there are now 154 active cases in regional local government areas under stage 3. That number continues to drop as well. Those 3 communities or greater communities that had been of concern to us, Greater Geelong has now 50 active cases, just 1 new case overnight. Greater Bendigo has 9 active cases and no new cases, and Ballarat has 6 active cases and no new cases. Can I continue to make the point that the regional Victorians are doing a fantastic job, as are the vast majority of all Victorians, but the numbers are low in regional Victoria and we want to keep them that way. So whether you're in regional Victoria or anywhere in the state, testing is critical to that. Please come forward and get tested if you have even the mildest of symptoms as soon as those symptoms begin. That is a really important thing that you can do, and it gives us that more complete picture of how much virus is out there, and we're then able to work with you to keep you safe, your family safe, and indeed others that you've come into close contact with. Please come forward and get tested, even if you've got the mildest symptoms, and please come forward for that test as soon as those symptoms begin. There's more than 190 test sites across the state. There's also provision for us to come and visit you if your circumstances are such that you can't get to one of those 190 sites. We ask that Victorians do that because it is critically important to the strategy continuing to work, and it is working, seeing these numbers fall day on day. And certainly the trend over the last 2 weeks is very promising and one that we are very pleased to see. In terms of aged care outbreaks and active cases, there are 1,225 active cases. There, in terms of aged care disability facility settings and active cases in those, there are 44 active cases. That is 30 amongst staff and 14 amongst residents. I don't have a total shifts work number for you, but if I can provide that a bit later in the week, then I most certainly will. Now, in terms of other announcements we're making today that are very important and will be of great interest to all Victorians, next Sunday, the 6th of September, we will announce the roadmap to ease the restrictions that we've all been living under. It is too early today to settle that roadmap and to lock that in, as it were. Another week's data is critically important to make sure that the strategy continues to work and for us to have a better sense of how long it's going to take to drive these numbers down to very, very low numbers so that they can be contained and controlled without the need to put restrictions back on over not just weeks and months but over a longer period, finding that COVID normal and locking that in for many months. That's the aim. That's what the strategy is working toward. Now, there will be a number of key principles, and as I foreshadowed yesterday, we will be engaging from later on this afternoon, adding to the enormous number of meetings and discussions that have been held with business, with unions, with community groups over these last 6 months, and certainly quite intensively in recent times. We will begin a fresh round of important consultation to talk about many of the practical issues that will be central to the decisions that we announce and the roadmap that we foreshadow on Sunday. There will be a number of key principles that underpin this opening up roadmap. Firstly, we have to ensure that physical distancing, including following density requirements, making sure staff work from home wherever possible, limiting the total number of staff and customers in any enclosed area, and stopping carpooling. That has to be a feature of opening up and getting people back to work. Wearing a face covering at all times in the workplace and ensuring that PPE is used, particularly in those higher risk industries. Requiring hygienic workplaces, so things like high touch points being regularly cleaned, staff regularly washing their hands, the availability and the use of hand sanitizer, so on and so forth. And finally, continuing to act quickly if a staff member becomes unwell and having a policy that can be fairly described as strict when it comes to keeping staff at home if they're unwell and making sure that they're not at work between when they have a test because they've got the onset of symptoms and when that test result comes back. They are common sense principles, but they're very important and they will have to underpin each and every one of the decisions that we will announce and the pathway that we will share with Victorians on Sunday. I know and understand that just as the vast majority of Victorians are doing the right thing, and that's central to this strategy working, I know that Victorians also want the clearest picture possible of what the next phase looks like. We cannot provide that certainty today. We cannot provide a detailed roadmap today, but we will provide that on Sunday. Another week's data is almost invaluable. I know a week feels, and indeed is, a long time locked at home, but it's also a very lengthy period of time when it comes to understanding what this virus is doing. It moves fast, it does so silently, and as we've seen quite a bit of commentary today, particularly comments made by the Deputy Chief Medical Officer in Canberra, the numbers are too high for us to open at this time. It is also very, very challenging for us today to predict with any certainty where we're going to be in a week or 2 weeks. But there is an enormous amount of work going on, modelling scenarios being run through various supercomputers. There is an enormous amount of work going on, and we will be in a position to be able to share that roadmap, what it will look like, its various components and phases with the community on Sunday. If we could do that today, and what's more, if we could be completely certain that on a given date we would have with 100% certainty a given set of rules, then of course we would be sharing those with people today. That is not the nature of this virus, though. It moves so rapidly, it is dynamic and wicked in many ways, and that's why a further week's data plus consultations on many of the practical issues, I stress adding to the many thousands of discussions that we've already had, will mean that we can put forward a blueprint, a roadmap that has more certainty. I will just say ahead of that though, it cannot be 100% certain, because everything must be based on case numbers, everything must be based on data and science and the very best of medical advice provided by our expert public health team. So they are significant announcements. That is a clear timeline, and one that I think will be very well received by the Victorian community. This strategy is working, but it is too early for us to either A, open up right now, or put forward a detailed roadmap as to what that opening up will look like. Just before I ask Brett to make a few comments, I just want to make a couple of further points. I am so proud of every single Victorian who is doing the right thing. I am deeply, deeply grateful to every single Victorian who is staying the course, who is making their own personal contribution to a strategy that is defeating this virus. We will defeat this second wave, and if we do it properly, and we will, with a phased, appropriate, safe and steady opening up, then we will avoid a third wave. We will avoid, again, losing control of this virus, seeing thousands of people in hospital and hundreds of people losing their lives. That's what we're aiming for, not just a set of rules and an opening up that lasts for a very short period of time, but instead gradually working and finding that COVID normal, and then to the best of our abilities collectively, locking that normal in, not for weeks, not for a month, but for many months. That is our plan, that is our strategy. It is working, and we will be able to have much more to say about that on Sunday. Another week's data when it comes to fighting this virus is so important, and we do hope that over the course of this week we continue to see numbers fall further. I might just now ask Brett to speak to the epidemiology of the day, and then we're happy to take any questions you have.
Thanks, Premier. Certainly 73 new cases and an actual overall increase of 65 is good news, but it's not better or worse than's been modelled. It's more or less on track, but it's a track that is a good track in terms of where we're headed, and we've seen a steady but gradual decrease in numbers right through the last week, and is expected to continue from here. It does mean that we're easing the active cases that are in the community. We're easing the pressure on our hospital system in terms of hospitalised cases and ventilated cases, and the number of aged care active cases and disability cases continues to drop. Is equally on track in that regard. As you'd know, there were over 500 active cases at one point in regional Victoria, so to be at the 150 mark is a very gratifying figure to see. On the aged care outbreak deaths, as you know, 41 deaths reported today. There is a reconciliation that we've needed to go through. These are deaths that have happened over previous weeks, including going back to late July. There are Commonwealth reporting obligations, there are state reporting processes, and we need to reconcile those cases so that whatever the Victorian Aged Care Response Centre is reporting is absolutely consistent. The Commonwealth has strengthened the reporting obligations in early August based on a need for that VARC to have absolutely definitive data on deaths that have occurred in residents who have coronavirus. And so in early August there was a mandatory reporting to the Commonwealth that also goes to VARC on that basis. But some of that is being caught up. It is not about deaths having occurred just now or just in the last week. They are deaths that have occurred over several weeks. Of course, all of those deaths have been known to the facility. They've, of course, been known to the families of those residents. But it is heartbreaking to see a number of that magnitude. But it is a reflection of just how vulnerable those populations are, and why we need to be mindful of the danger of this virus, especially in aged care settings, but also in disability settings and other places where individuals vulnerable to severe illness reside. numbers are resolved, I think there will be some facilities that may still have a few cases to be reported through to the VARC, but I don't expect a number anywhere near close to 41 to occur again. But we will continue to reconcile with the Commonwealth numbers and to have a single source of truth in terms of reporting that.
Do we know if the majority of those 33 figures have come from one home or anything like that? Is that?
I don't know specifically. I don't think so. I think they've come from a number of facilities that have reported just recently.
As part of the roadmap out, will that feature, I guess, the backlog of surgeries that have been cancelled? And how there are some people that would have cancelled surgeries and been relieved by that. How do you then get people to have those surgeries as part of getting us back on track?
Yeah, it's probably for the Premier to speak to.
Thanks for the question. It's a very good one. It's not specifically referenced in the roadmap, but it will be on Sunday. And we will provide not necessarily a definitive date when surgery in different categories will resume. But as you know, Category 1 surgeries and the most urgent Category 2 surgeries and their categorisations that are made by clinically trained staff, so clinicians make those judgments, and if a patient's condition was to deteriorate and they were to move from Category 2 to Category 1 or from kind of the back end of Category 2 to a more urgent Category 1 case, then of course their surgery happens. We know that many thousands of people would have had their surgery done, but this pandemic has meant that just wasn't safe for them, for staff, and of course we had to make sure we had sufficient capacity, enough beds that were open to be able to receive very large numbers of residents from residential aged care and to treat a number of COVID patients beyond that. So we'll get elective surgery back to where it needs to be. It's not an easy decision, certainly not a government like ours that has done as much elective surgery as we have. It's been a priority to get those numbers down and to have more people moving through the system as fast as possible. That's been a real feature of our health policy over these last 6 years. But there will be blitzes, there will be substantial additional effort, and I'm very confident that our surgical teams and indeed the medical teams who support that as well will be up to that task. But I'll have more to say about that at the appropriate time.
Premier, is it possible that stage 4 will be extended beyond September 13?
We can't rule out settings in 2 weeks' time. It's very difficult to know what those settings will be. They'll have to be guided by the data, by the science and by the very best medical advice. What we'll provide on Sunday will be the plan that we intend to put in place, the plan that all things being equal we will put in place. But again, it's never been my habit or my practice to be making commitments that we can't keep. So everything has to have that asterisk next to it. And I know that's deeply frustrating. It's frustrating for all of us. But as the Deputy Chief Medical Officer has noted today, as Brett notes, as we all, I think, deep down we know and understand, that if we were to open up with numbers anything like what we've had, even with a really positive trend, then those numbers will explode and we will lose control of this again. And instead of having that long-term, stable COVID normal where businesses can return, where customers can be out there purchasing, where workers can get back to work, where profitability can come back to so many businesses, so lives being saved and livelihoods, we won't have that. We'll have a seesawing effect where the rules are on and off. That'll do enormous damage, and it of course means also that we're likely then to have many, many thousands of people needing hospitalisation and many people dying.
So given a staggered return, is it safe to say that the Burnians in particular won't be leaving town for those holidays?
I think that we will jealously guard the low numbers in regional Victoria, and I think every regional Victorian would want us to do that. At the same time, I think people in Melbourne know and understand that Melbourne is in a different place, the science and the presentation of the virus is very different in metropolitan Melbourne than it is in regional areas, and keeping those numbers low in regional areas is very, very important, not just to us in a kind of strategic or academic sense. It's absolutely critical to us being able to open the whole state in a steady, cautious but in a progressive and sustainable way, each step after the other, and then locking in that COVID normal that, as I said, and I can only stress this again, a COVID normal that lasts for months, not just a few weeks. That sense of control and stability that I think, and business certainly tell me, is critically important to the most effective recovery and repair that we can possibly have.
So is it fair to say that stages 2 and stages 2 are going to look substantially different than
Yes, they will.
last time around?
Substantially different framework. This will be much more around a traffic light system, and we'll move through different phases. And there'll be some elements that might be similar to the stages that as we went into stage 4, but it'll be very different. And we'll have more to say about that obviously on Sunday. And waiting until Sunday means that we can have those next round of detailed consultations on very practical things, what's actually achievable, what's actually deliverable at a business by business, sector by sector level, as well as community groups, workers, unions. We'll be talking to all of them. But it also means we've got another week's data, and a week's data is a very precious thing, and it just means that our modelling and all the number crunching that goes on it's never certain, but it will be a more accurate picture of the way the virus is presenting, and a more accurate description of our enemy, and therefore will lead to a more successful fight against it.
Jeremy, are the numbers now too high? Where would you like the numbers to go down to?
Look, we've always resisted putting a number on this, but I would take you back. The Prime Minister was very clear a couple of months ago now that the strategy is a zero community transmission strategy. Whether that's possible, then we just have to see that unfold. But we want these numbers down as low as they can possibly be. And there'll be a point. There'll be a point where we have to make a decision, and there'll be a lot of work done this week based on the data that comes in every day, as well as the modelling and the trend work. Rather than 2 weeks back, it'll be last week and this week happening now, so it'll be a more accurate picture. We'll be able to then make a really difficult choice. So with numbers at X level, say by Friday this week, various models, various different options for opening up, they will all come with a risk that we lose some control. None of those models will be 100% safe. The question is calibrating that right, getting that right, doing that detailed work, and having the lowest risk possible of not being able to deliver that multi-month stable COVID normal where we can pounce on individual cases and outbreaks and not have to go to suburb-wide, city-wide, state-wide rules. That's the basic logic to this, and we're very confident we'll be able to have much more to say and to provide people with that clear sense of a pathway, a roadmap on Sunday.
Professor Sutton, you've said the numbers are currently on track. Where you're expecting them to be on Sunday, and where you're expecting by the end of this scheduled end to lockdown?
I would hope we're in the the ballpark of 40 or 50 by the end of the week. We'll see if that's the case. Again, there's a great deal of uncertainty around the tail of any epidemic. We're in a wave that is more complex than the first one we tackled, that was international travellers and their close contacts by and large, with a little bit of community transmission. We've had substantial community transmission, but as we get down to the 60, 70 numbers, we know that the number of mystery cases, community transmission cases where we don't know where they've acquired it, is getting to single figures. That gives us a little bit more confidence that we can get on top of it. And with the smaller numbers, we'll have greater and greater clarity around where the transmission is occurring. Of course, what we don't know is where we can't see where transmission is occurring. And that's why the call for testing is so critical every day, and why the call for people to hold the course, even as we get to very low numbers, is also so absolutely critical. Because holding the course is exactly the thing, when we're getting down to those very low numbers, that means that we can look at a summer that has some familiarity to us, where we can see friends and family, where we can go out to dinner, where we can have a Christmas dinner together, where we can enjoy those sunny days. So the pain that is happening every day now, we're all fed up with it. absolutely fed up with it. But holding the course, even as we get down to these very low numbers, is absolutely critical to get that control that we can be confident that we'll maintain. And our contact tracing now is at a point where every case is contacted within 24 hours. Almost every case is interviewed within 24 hours. The only ones that aren't interviewing are the ones who aren't picking up the phone and can't be found at home, or who are aged care residents who are a known part of an outbreak, who are demented, who can't be interviewed. Every close contact is contacted within 48 hours. So we've got a robust contact tracing that's been built over time and is now, more than enough capacity for the numbers that we're seeing. But we have to have both that in place and low enough numbers for it to be manageable on a day-to-day basis into the long term, including when we have outbreaks, because a single case can cause 100 cases in a week. A single case can cause 1,000 cases in a couple of weeks. So we have to be mindful that even low numbers do not give you that absolute confidence that everything is in control and it's all going in the right direction. Those critical settings are the ones to keep an eye on, and we don't know what we don't know. So testing has to happen, and those difficult to identify populations who may or may not be stepping up for testing, who may or may not be presenting for care, are also ones that we need to understand and reach into.
I don't know if this is for you or for the Premier, but do you anticipate many businesses are going to have to make changes on top of what they'd already made before we entered stage 4?
I think we're certainly looking at strengthening. These pillars are part of a really strong and embedded, multifaceted risk management and prevention strategy for each and every one of those businesses. They are definitely a step up in terms of the routine requirements of every business to manage that risk. And of course, they'll be different depending on the risk profile of all of those industries. But I think every single work setting needs to understand that there'll be some basic requirements that will very strongly want to be in place all of the time and across the board.
Look, I think that, for instance, if you look at some high-risk workplaces like meatworks, abattoirs, I think the notion that they would go back to kind of behaviour and practice that was pre-COVID, that won't be happening. Some of the stuff they've now embedded, and we're very grateful to them for doing it, I think that will be a feature, be an enduring feature. When it comes to cafes, bars, restaurants, pubs, I think that the improving weather and the part of the year that we're moving into does give us some options that we simply didn't have last time. So the notion of more outdoor eating, more outdoor service, and we're looking at that very, very closely, and we'll be having very detailed discussions with that industry, just as one example. But we want, throughout the course of the weeks and months to come, we want to get as many people back to work as quickly as we can, but it's got to be done safely, and it's got to be done based on the expert advice about what can be done at what speed and still maintain control. There is no economic benefit in doing this too fast and simply finding ourselves in a month or 6 weeks' time back in a situation where we do not have control of this. And what that will essentially mean is that all the hard work, all the sacrifice, all the pain that people have endured and are enduring now will have been worth nothing. And I just don't want that outcome. If I could provide a 100% certain roadmap today, then I would. But that would not be responsible, frankly, and that's not the way that I operate.
How do you make sure that we are engaging with...
I'll go here in a bit.
Thank you. How do you engage with those communities that we perhaps didn't engage with before while easing restrictions to make sure that we do know what's happening?
Sure. Look, I think through the course of this second wave, we have engaged with all those communities that needed to receive messaging in clearer terms, that needed to have a greater sense of ownership of this challenge. I'm confident that that community engagement, whether it be faith appropriate, language appropriate, culturally appropriate, I think we're in a much stronger position now than we've ever been. And that is, I think, reflective of effort, but it's also reflective of community leadership. So there are many, many people who've really stood up, and we're very grateful to them for playing their part in helping us to get those messages out. And the third thing, of course, is when you are dealing with return travellers on the Mornington Peninsula being a main feature of the first wave, then you're hardly going to be spending the same amount of time we have this wave speaking to multicultural communities in the northern and western suburbs. But I think we're better for that now, and we're stronger for it, and I think that our response will be even better coming out of the second wave. But again, only if we've properly defeated the second wave. If we let our frustration get the better of us, and I have no doubt, I'm completely certain about how frustrated people are and a sense of fatigue, but there's just no choice. There's no choice but to see this through. If we pretend we've seen off the second wave and we actually haven't, if we pretend we've won a victory and we actually haven't, then that sense of relief, that opening up, will not last very long at all.
Premier, have you redrafted the state of emergency bill, and are you able to share any?
I've got no announcements to make about that today. What I can say, though, is we are continuing very productive discussions with the crossbench, and we're confident that we'll be able to get a result that fairly balances the protection of public health, but also gives us the legal certainty not to draft a plan to keep the place closed, but indeed the legal certainty that is essential to a plan to open up. That's what we are working towards, and I'm very grateful to the crossbench for the constructive way in which they've engaged with us. I'll just give you that example. I've used it a few times, but just think for a moment how difficult it is to try and craft a plan to open up when you can't be certain that every single person who's got coronavirus in October, November, December, May next year, whenever it might be, can't be required to isolate at home. That becomes incredibly difficult. And I think a number of, whether it be the Police Association or others, have made that point, that it just gets really, really hard to plan for opening up if you don't have a legal framework. And that's what the bill's all about. And when those negotiations are concluded and when the votes are cast, I am confident that we'll finish up with a plan that protects public health, but rules that allow us to open the place up. That's what we want to do in a safe and steady way.
Are you disappointed that Adam Somyurek says he won't be voting at Parliament this week?
I'm long past being disappointed in Mr Somyurek. His choices are matters for him. You can raise that with him.
Professor Sutton, just back to these deaths. You said that it's possible that a further backlog could come through in coming days. Are you aware of any more deaths that haven't been reported as yet?
I know there are a number. I don't know the exact number because they haven't been formally reported to us, but I know that there's still some reconciliation between numbers that have already been reported to the Commonwealth that I expect will reconcile in coming days.
So should we expect more days of 40-odd deaths?
No, I don't think so. I think there are a small number that are still outstanding, but that they'll come through and we'll reconcile them and we'll have a single number every day going forward.
So the current death toll of, I believe it's 530 something, obviously isn't accurate at the moment then?
So we have to see what gets reported to understand exactly what is counted, again, with a single definition between Commonwealth and state governments on exactly what that number is. I think there are a small number of outstanding reports that need to come through to reconcile.
Can I just add to that? By just, again, reaffirming for everybody so there's complete clarity, our government, the federal government, public providers, private providers, officials, agencies, they're all working together as closely as possible with one focus, and that's simply to provide the very best care and support to residents, some of whom become patients because they need to be transported to hospital, some are treated and cared for in place, and of course their families. That's our clear priority, and that won't change at any point. So there's no sense of critique or commentary or criticism. We just need to reconcile those numbers. But we thought it was appropriate to put some context to that number today. They are not all people who have tragically passed away yesterday, albeit even one death is one death too many. But we thought it was fair and reasonable to make that point. But don't anyone read into that anything other than all governments, prime ministers, premiers, all of us, we're all working together.
Premier, are you aware of any comorbidities in the latest cases?
Not that I could go to, no. I think that when you look at, you mean in relation to deaths? Look, I think it's fair to say, it's not for me to offer a medical opinion, but that we've made the point many, many times that for many people, the vast majority of people in residential aged care, there will be some underlying health issues. They range. There can be some that are very mild and minor, and others will be much more acute and chronic. That's just a statement of fact. That's not a value judgment. But that's what makes those communities and those cohorts as vulnerable as they are. As to the degree to which the virus has contributed to them passing away, they're not matters for Brett or I. They could be matters for the coroner, and I think Justice Kane has made it clear that he's doing some work to that end.
Highly experienced principal today was reported. A highly experienced principal today was reported as saying that some children in prep may lose more than half a year's worth of education because of missed school.
Yeah.
What's your view on that?
Well, every student's unique, and our commitment as part of recovery, and indeed right throughout the year, is to provide the dedicated, personalised, tailored support to every single student. This academic year has been like none other. But I think it's probably my approach and the approach of the Deputy Premier and Education Minister is during the rest of this year and into 2021 to provide any and all support to every single student to make sure that if there are any gaps, that we deal with that issue and that we work as hard as we possibly can to make sure that every student is getting the foundational learning that they need and which will be so important and serve them so well into the future. That's our mission every day, but that task is an acute one and a really important one, and we'll have much more to say about how we're going to facilitate that. But I'm very confident that our teachers, and let's never forget support staff, parent community, student community, everyone knows this is a very different year, and there will be things we have to do differently next year, but I don't think that is necessarily the way for us to go. It's much more about tailoring support and catch up and filling any gaps on a very personalised basis, because every student, even in a normal year, every student is at a different place, but 2020 has proven to be an educational year like none other.
How comprehensive will the roadmap be? Will it cover schools, restaurant owners? Is it gyms, everything? Who
It'll
should
cover
expect answers on Sunday?
Sure, it will cover industries, in the first instance, industries that have been closed as part of stage 4. It'll then cover all the usual settings that we've all become well and truly accustomed to, things like the cafes, bars, restaurants, retail, personal care, all of those sorts of different categories that we've used. The degree or the amount of information we can provide for each of those may vary. I want to be clear about that. We're not going to be able to necessarily give every single sector a hard and fast date at which they will be reopening. Some will have to be subject to the data and the case numbers a week after we begin reopening, 2 weeks after we begin reopening, so on and so forth. I think that logic just tells you that's the only way you can do it. Because again, the nature of this virus means that it is very, very difficult to make predictions for the future. It's very, very difficult to provide certainty, even though people quite legitimately want it. It is very challenging to provide that. Except for this, there are a number of settings, there are a number of ways you could go where you can have complete certainty that case numbers will explode. No one wants that. Nobody wants that. Because that would be far from finding a locked-in COVID normal for months and months and months until we get the vaccine. That would be bouncing in and out of rules and restrictions, open 1 minute, close the next. We don't want that. We're doing everything we possibly can. A big team is doing everything it possibly can to avoid that. And in thanks for what they've already done, because we've worked very, very closely with business, very closely with community groups, very closely with unions and workers. I thank them for that, but in anticipation of the really important consultation that will occur this week on very practical issues, but they're very important issues. I thank them in advance for that, because it's only through that understanding and that collaborative, cooperative approach to these things that you can get the best settings.
What about having visitors to your home? Will that be included in the
Well,
roadmap?
yes, we'll have more to say about those matters also. I would just say, again, I don't want to be anything other than frank. We know that there's a lot of feedback around people who live on their own, and that sense of isolation, that's a real concern to us, and we hear that message. And we'll have more to say about that. In terms of large gatherings in your home, though, there's no denying, and there's simply no escaping the reality that large groups of people congregating in their home, families visiting each other, friends visiting each other, the informality of that, as opposed to a restaurant or a cafe, for instance, was a massive contributor to the number of cases that we've seen in this second wave. As unpleasant as it is to have to kind of forecast that it might be a while before you can have a barbecue with a large number of friends, or even family, like a big gathering, as difficult as that is to try and get your head around, you can't deny the fact, because the evidence is really clear, that that sort of behaviour, particularly where people perhaps let their guard down because they're in their own home, there's not a waiter there making sure that you keep your distance, making sure that you're only there for a specified time, making sure that everything is cleaned to that kind of industrial standard. You can't deny that. That has been a big factor in this, and we will have to be alive to that when crafting the way out of this.
Premier, given that the numbers in regional Victoria continue to fall and don't seem to continue to fall,
Yep.
can they be sure that they will have restrictions reduced in 2 weeks' time?
We will have the most generous, the most certain, safe and secure set of rules. So we'll have the steadiest and safest set of rules we can possibly have, and that'll be guided by case numbers. And that might mean that there's some complexity comes to it because different parts of the state are in different places, but we'll try and have rules that can be enforced. We'll try and have a roadmap that can be easily understood, but we'll also take into account the way the virus is presenting, and there are differences. That's why working as hard as we can to make sure the case numbers in regional Victoria remain low. We do that for a number of reasons. One of them is because it gives us more options than we would otherwise have. But the time for us to speak in more definitive terms on that issue and many others is, of course, Sunday.
You mentioned people living alone being a concern. Professor Sutton said on Friday night that was under active consideration. Do you envisage changes to that situation before the 13th of September?
As soon as it's safe for us to potentially have a different set of rules for those who live on their own, we will make those announcements and we'll try and bring those changes in as quickly as we can. But again, that has to be done safely too, because whilst a sense of loneliness and a sense of isolation is a very real thing, and we accept that and understand that, and we're motivated to try and do whatever we can about that, the fact that you live alone doesn't mean that you're immune from spreading this to someone else if you start having visitors coming in. But we think there's a way forward there, and as soon as we're able to make announcements about that, we will.
And you mentioned family gatherings. Should families be concerned about spending Christmas together? Is that going to be
Well,
possible?
look, I'll make this point to you. We had a very different Mother's Day. No one was happy about that. We're going to have a very different Father's Day. I want to make sure that we have a Christmas Day that's as close to normal as possible. And if we do this too quick, if we do this chasing something that might be popular for a few weeks, if we forget that it's a pandemic and think that it's a popularity contest, well, then Christmas won't look normal at all. It'll be a very, very different Christmas Day. We'll be up and down, in and out of different restrictions and different lockdowns. I don't want that. I want to find a COVID normal based on the best of medical advice, where there will still be some rules, but where we can lock that in for months, not weeks, months. Now, that won't be easy. That'll mean, because there'll be inevitable cases, there'll be inevitable outbreaks, we'll have to pounce on all those, and we will. But you can be guaranteed, like even as uncertain as this is, you can be certain of this. If we open up too quick, then we will lose control of this. The numbers will explode, and all the sacrifice and hard work that I'm so proud of Victorians for making and contributing will have been worth nothing.
I mean, more protesters have been arrested in the northern suburbs where this virus has been out of control there. Is that more disappointing to see people from those kind of areas where the virus has run rampant?
I'd make the point, Bridget, I'd say that it's not appropriate to protest anywhere. It is not appropriate to protest anywhere. And, it disappoints me more than anything that the behaviour of some of those people takes away from the amazing work, the absolutely amazing work that the vast majority of Victorians are doing. And I just don't think that's fair. They're the people we should be focused on. So it's not a criticism, but we should be focused on those Victorians who are not enjoying this, certainly not, but they're getting the job done. I'm proud of them, I'm grateful to them, and there'll always be some who do the wrong thing, but no matter what your postcode or what your purpose, protest is not safe, it's not smart, it's just not right, because it potentially puts at risk everything that people have worked so hard to achieve.
What do you make of the Treasurer Josh Frydenberg's comments this morning? He said the situation here in Victoria is the biggest public policy failure in living memory by a state government.
I'm not here to argue with Josh Frydenberg. I haven't got time to have an argument with him or a debate or even a discussion. I'm very focused on getting the job done.
Are you disappointed though? Does that widen the gap between
What
the federal government's stance and your stance?
No, what I'd say, the things that I'm disappointed about, the things that I'm motivated by, the things that I'm concerned about are driving these case numbers down. Every time we have someone pass away, every time we have someone break the rules and potentially contribute to the virus spreading, every time that we have one of these challenges, that's what motivates me, that's what I'm concerned about. And I just make the point I made yesterday. None of us have the luxury to be playing politics with these things. I'm just not going to do that. I'm just not going to do that. Our nation and our state requires all leaders of all political persuasions to work together. That's what I'm doing, and that's what I'll continue to do. I'm just not interested in having an argument or a fight with anything or anybody other than this wicked coronavirus. That's where my focus is, and I think that's where Victorians want my focus to be.
He is Victorian though, he lives in Melbourne. Do you think those comments are helpful?
Again, I'm not here to have a debate with anyone really, and I'm not going to be engaging in those terms. My focus is exclusively on fighting this virus.
We've had doctors at the Royal Melbourne Hospital have been doing 14-hour shifts in the same PPE. That doesn't sound like it really meets safe working standards.
I'm happy to chase that up for you. We can speak to somebody at the Royal Melbourne. Won't be Brett or me, it'll be probably Andrew Wilson through his responsibilities as the Chief Medical Officer, but we're happy to chase that up for you.
14,000 tests yesterday. I know we usually see a lower number on weekends. Are
We
you
do.
happy with that number though?
Oh, look, I think that you won't hear me, I doubt that I will stop asking people to come forward and get tests of symptoms as soon as those symptoms begin, and then asking people to stay at home until they get their test result. And the test results are coming through quicker now than they ever have, so less than one day. You won't see me stop doing that because testing will always be important. But we will see less people as the weather improves potentially, as numbers drop. We will see with very few cold and flu symptoms, very few flu symptoms out there. You'll see the numbers come down in terms of the number of symptomatic people. Therefore, testing numbers will come down. We look at this very, very closely in fine detail to make sure that the test sample that we've got, the number from each day, is a significant and an appropriate measure of how much virus is out there. More people getting tested is always better than less. Numbers do drop a bit on weekends, but I'm not displeased with that number. I just again say to every single Victorian, if you've got even the mildest of symptoms, you've got to come forward and get tested as soon as those symptoms start. It's a massive thing. It's quite simple in many ways, but it makes a massive difference to us being able to open up with a sense of certainty, with a sense of confidence that we can keep control of this. So please, no matter where you are, no matter what your circumstances, there's 190 sites. If you can't get to one of them, we'll come to you. getting tested when you've got even the mildest of symptoms is absolutely essential. And that's why we're so grateful that even on a weekend, even when perhaps many people were focused on doing other things because the weather was better, we still have had the best part of 29,000 tests over the course of the weekend. But we want those numbers to stay as high as possible and to be a true reflection of the number of people who've got symptoms right across our state. Any other issues? If not, thank you, and we will see you tomorrow.
Thank you very much.
Thank you.
I won't order my turkey just yet. Sorry? I won't order my turkey just yet.
Come on.
To yourself, don't you?
There'll be a Russell turkey, so there'll be a toilet paper.
I've eaten with you, and I reckon you can take care of it. I'm absolutely certain of that. Cake, sweeter tooth than turkey.
Yeah, it's about the
The spread of coronavirus between passengers on a Sydney bus has prompted fresh calls for masks to be made mandatory on all public transport. The CBD to Randwick